Welcome to the program. We begin in the health sector, where health services will continue being paralyzed even as the Employment and Labour Relations Court ordered striking health workers to temporarily resume work. However, the Kenya National Union of Nurses Secretary General Seth Panyako says nurses will only go back to work once the national government addresses the issues. The strike comes amid a global pandemic that has crippled nations across the globe.
Unatuambia turudi kazi. Hatuwezi kukubali kurudi kufa. Maana kurudi kazini bila makwanda ya kufanyia kazi ya kutukinga sisi ni kwenda katika kichinjio na tukwenda kukufa. Hatuwezi kukubali kukufa. Mimi nakwambia Kakwe wewe, sikia mimi vizuri. There is no going back to work. We want comprehensive medical cover, it must be there. We want group life insurance, it must be there. We want all our contracted nurses who have not earned for 14, 15 months to be paid all their salaries. Unatuambia twende kazi. And yet we have nurses who have not earned for 15 years. Are you human? Are you human? There will be no going back to work until all our issues are addressed. And for the first time, I want to tell you, you can see the entire nursing fraternity is united. There is no dissenting voices, because we are fighting for a justified cause. We will not, and I am telling you, Kakwe, we will not go back. Just sit down there, bring the money, address our issues, and we'll go back to work.
All this comes even as the Kenya Union of Domestic Hotels, Educational Institutions, Hospitals and Allied Workers, KUDHEHA Secretary General Albert Njeru is asking the government to urgently address the ongoing strike by health workers to avert a looming crisis, given that doctors will also be downing their stools tomorrow. Well, he says the strike is likely to claw back efforts that have been put in place to combat the COVID-19 pandemic.
Building bridges initiative. Workers need BBI. Government, come closer to the workers. Workers, let's go closer to the government so that we can have a lesson and a quick way of solving and addressing pertinent issues affecting the workers of Kenya, affecting the citizens of Kenya, and above all, the children, the women, and even men. So we are calling the Senator to intervene as quickly as yesterday, so that we can be able to see workers going back on duty. Issues of demands are always put on the table, and I can assure you, workers are waiting to listen together as a team. Workers are ready. This is our country. Workers are ready to dialogue. Let's give dialogue an opportunity. But let us not have arrogancy. Let us not have people going to court like yesterday. Call us for a meeting. Workers are ready.
The current health crisis is set to worsen on Monday when medics join other health workers in the ongoing strike. Doctors have announced they will down their tools beginning Monday midnight after the expiry of their 2 weeks deadline. Doctors say there has been no headway in attempts to avert the strike by the government, and now will be joining nurses and clinical officers whose strike will be entering the third week. Baldin Waliaula with more details.
Kenyans should brace themselves for tough time ahead as doctors join other health workers in the ongoing strike starting Monday. The medics say their efforts to strike a deal with the health and labor ministries have failed to materialize. The medics suspended their strike for 2 weeks to give room for negotiations. But so far, things remain as they were.
But if the issues are not addressed comprehensively, would have given enough time. 35 days in total would be enough time to address. That would only show that there isn't much political will to resolve the matters.
Effective Monday night, medical officers, interns, pharmacists, dentists, medical specialists and all medical superintendents will not be offering their services to the public, and those who depend on public hospitals will have to look for an alternative.
We have restated our position for a record time more than 10 times. The issues remain the same. And we want to make it clear that we still don't have a tangible way forward. So as we live here, the ball is squarely on the court of the employer.
This means the situation will now move from bad to worse because no one will be offering service to patients. For the last 2 weeks, clinical officers and nurses have been on strike, and there is no hope of resolution.
We expected that at least there could be a commitment in all the issues as it has been it was presented to them. Our demand have not been met. So to say is that the strike continue.
And now religious leaders are calling on the government to act fast to save the health sector from crumbling.
Wakati juzi madaktari waliweka vikwazo na kusema tarehe fulani tutagoma, mimi nafikiria serikali itaondoa mambo ya BBI na kurudia kwa maisha ya binadamu. Lakini hatujaona, hawajajali, mpaka wa leo hawajajali, na watu wamekufa, wamemalizika.
Same message coming from Kenya National Union of Nurses Secretary General Seth Panyako.
Hatuwezi kukubali kurudi kufa. Maana kurudi kazini bila makwanda ya kufanyia kazi ya kutukinga sisi ni kwenda katika kichinjio na tukwenda kukufa.
Apart from a risk allowance, the doctors are also demanding for the employment of 2,000 more medics and a provision of a comprehensive medical insurance. Building Walyaula, KTN News.
Elsewhere, Nyamira Governor John